Hi, it's me, Caloris. I am going to demonstrate giving medication through an enteral tube. So what I'm doing again, I'm going to go ahead and I'm going to check my orders and I'm going to compare it, the labels and the orders with what the doctor has ordered. I'm going to look at that twice actually. I'm checking to make sure the need for it. She is requesting some PRN liquid Tylenol is what she has. Um, and so she does have an order for that. She can have it, and it is going to go through her tube. So we're going to go ahead and get started. So what I'll do is I've gathered up the equipment that I need. I've washed my hands. Um, I'm in here with the patient. Susan, how you doing today? Could you give me give me your name and date of birth, please? Okay. Do you have any allergies? Okay. Well, they're saying I was told that you have a headache, and so how would you rate it on a scale of 1 to 10, 10 being the worst? Okay. Well, you do have an order for a PRN Tylenol, and we can get you more comfortable. I know they tried to reposition you and everything, and then just you still have it. So we're gonna check. We're gonna go ahead and get ready with it. So what I'm gonna do is I'm gonna go ahead and wash my hands. So we'll go ahead and sanitize our hands, get all that squared away. Okay. I am gonna make sure that the patient is in we want the patient to be in a good 45 position. They can do a 30, but they prefer 45. Um, so what I'm going to do, I've washed my hands. So now I'm gonna go ahead and put on my clean gloves. So, get them on. Okay, and then we'll go ahead and get on the next set here. And what we're going to do, we're going to check for the residual. Well, actually, before I do that, I want to check for tube placement. So the way I would do that is I have my syringe, and I'm going to go ahead and I'm going to pull up. I'm using the cup for the patient, and I'm going to go ahead and we would pull up that. Okay, so I've pulled that up. Some people use the paper, they get the pH, and it's saying that if it's 5 or less, we know that it's okay, and that's the gastric. It's a good indicator that that's the gastric pH less than 5. That's good. Okay, then in order to check the residual, I'm gonna go ahead and draw up 30 to 60. I'm gonna go ahead and do 30 of the air, and then I'm gonna go ahead and get some more, and I'm gonna look at the content. We're looking at see how much we get rather, and then from there, I'm gonna go ahead and put it back in. Now, if I continue to get, it depends on your policy or agency, but if you got more than 250, you would definitely want to call the provider. Now, my patient isn't hooked up to any tube feeding right now, so I was able to go ahead and start right on in. But if she was hooked up, of course I would unhook her from that and go from there. But what I'm gonna do, okay, so I'm gonna remove the plunger here from my patient. So now that we got it, I'm gonna go ahead and I'm gonna go ahead and flush her. You want warm, tippet water, but I'm gonna flush her with 30 ml of water into the medicine cup. Okay. So then I'm gonna go ahead. Now her Tylenol is Tylenol liquid, 15 ml, and so then we want this to go by gravity. And so I've measured the 15 ml in the measuring cup of the Tylenol. And like I said, we're going to go by gravity. And then to finish it up, we're going to go ahead. I'm going to finish it with a 30 ml of water, going by gravity. Okay, so she's done with that, and what I would do is, go ahead and clamp it, and then from there, you know, I don't want to lay her back down flat because I've just given her this medication. I would make sure I'm going to take my gloves off. I would make sure that my patient has her call bell. Um, we're gonna. That's basically all that I would do. I would go ahead and I'd wash my hands, get rid of my supplies, um, and I would come back and assess her, of course, to make sure that the headache is gone. Thank you, and that's how I would do the sub Q.